Have you checked your bank account lately? Because if you're receiving Social Security benefits, you might be in for a pleasant surprise. A new $300 increase is making its way to millions of beneficiaries across America, and this could be the financial relief you've been waiting for. But here's the catch. Not everyone qualifies, and there are specific steps you need to take to ensure you receive every penny you're entitled to. I'm going to break down everything you need to know about this critical update. Who qualifies? When will the payments arrive? What do you need to do right now to maximize your benefits? And most importantly, how will this impact your monthly budget and financial planning for the rest of the year? The $300 increase we're discussing today represents a combination of factors affecting Social Security beneficiaries in the current benefit year. This isn't just one single change. It's the result of multiple adjustments working together to provide additional financial support to those who depend on Social Security as their primary or supplementary income source. First and foremost, we need to understand that Social Security benefits are adjusted annually through what's called a cost of living adjustment, or COLA. This adjustment is designed to help benefits keep pace with inflation so that your purchasing power doesn't erode over time. Think about it this way. If your Social Security check stayed exactly the same amount year after year, but the cost of groceries, medications, housing, and utilities kept going up, you'd effectively be getting poorer each year even though your check amount didn't change. The Social Security Administration uses a specific formula based on the Consumer Price Index for urban wage earners and clerical workers, known as CPIW. I know that sounds like alphabet soup, but bear with me because understanding this helps you grasp why your benefits change from year to year. The CPIW tracks the prices of a basket of goods and services that typical American households purchase regularly. When these prices go up, your Social Security benefits should go up too, at least in theory. Now, here's where the $300 figure comes into play. For many beneficiaries, the combination of this year's COLA adjustment, along with other factors we'll discuss, results in approximately $300 more per month compared to what they were receiving previously. However, and this is crucial, the exact amount varies from person to person based on several factors, including your primary insurance amount, your claiming age, your work history, and whether you receive additional benefits like spousal or survivor benefits. Let me paint you a picture with some real numbers. The average Social Security retirement benefit before the recent adjustments was approximately $1,907 per month. With the current COLA increase and other adjustments, many beneficiaries are now seeing monthly payments in the range of $2,200 or higher. That difference, roughly $300 or more, is what we're focusing on today. But here's what makes this particularly significant right now. We're living in times of persistent inflation. Your grocery bill isn't what it was 3 years ago. Your utility bills have climbed. If you're renting, your landlord has probably raised your rent. If you own your home, your property taxes and homeowners insurance have likely increased substantially. Prescription drug costs continue to rise despite various reform efforts. In this economic environment, an extra $300 per month isn't just helpful. For many beneficiaries, it's absolutely essential for maintaining their standard of living. This increase also comes at a time when many seniors and disabled individuals are struggling with healthcare costs that Medicare doesn't fully cover. The average Medicare beneficiary spends thousands of dollars annually on out-of-pocket healthcare expenses, including Part B and Part D premiums, deductibles, copayments, and services that Medicare doesn't cover at all, like dental care, vision care, and hearing aids. An additional $300 monthly provides some breathing room in budgets that have been stretched increasingly thin. Now let's talk about who actually qualifies for this $300 increase, because this is where I see the most confusion and, unfortunately, where some people miss out on benefits they're entitled to simply because they don't understand the eligibility requirements. Retirement benefit recipients, if you're currently receiving Social Security retirement benefits, you're automatically included in the COLA adjustment that contributes to this increase. You didn't have to apply for it, you didn't have to fill out additional forms, and you didn't need to contact Social Security. The adjustment happens automatically based on your existing benefit record. However, the actual dollar amount of your increase depends on your specific benefit amount. Social Security uses a percentage-based increase, not a flat dollar amount. So if the COLA is, for example, 3.2%, that percentage applies to your individual benefit amount. Someone receiving $2,000 per month gets a different dollar increase than someone receiving $1,500 per month, even though they both receive the same percentage increase. Let me give you some real-world examples to make this concrete. Let's say you're receiving $1,800 per month in retirement benefits. A 3.2% COLA would add approximately $58 to your monthly check. But wait, you're thinking, that's nowhere near $300. And you're absolutely right. This is why I emphasized earlier that the $300 figure represents a combination of factors, not just the COLA alone. We'll get into those other factors shortly, but first, let's continue with who qualifies. Disability benefit recipients. If you're receiving Social Security Disability Insurance, known as SSDI, you also qualify for the same COLA increases that retirement beneficiaries receive. There's no difference in how the adjustment is calculated between retirement and disability benefits. Your disability benefit receives the same percentage increase. This is particularly important for disability beneficiaries because many are living on very tight budgets with limited ability to supplement their income through work due to their disabling conditions. The substantial gainful activity limits, the amount you can earn without jeopardizing your disability benefits, haven't kept pace with inflation nearly as well as they should have, meaning disabled workers face even tighter financial constraints than retirees who can often work part-time without affecting their benefits. Survivor benefit recipients. If you're receiving survivor benefits based on a deceased spouse's or parent's work record, you also qualify for the COLA adjustments. Survivor benefits work somewhat differently than retirement benefits in terms of calculation, but the COLA applies in the same way. The percentage increase applies to whatever survivor benefit amount you're currently receiving. For widows and widowers, this is especially significant because many are living on reduced household income after losing a spouse. Even if both spouses were receiving Social Security, when one spouse dies, the household doesn't continue receiving both checks. Instead, the surviving spouse typically receives the higher of the two benefit amounts. This represents a significant reduction in household income at a time when many expenses like housing, utilities, and healthcare remain the same or even increase. Supplemental Security Income recipients. If you receive Supplemental Security Income, or SSI, you also receive COLA increases, though SSI works on a different system than Social Security retirement, disability, and survivor benefits. SSI is a needs-based program, meaning your payment amount depends on your income and resources. The COLA increases the maximum federal SSI payment amount, which then affects your individual payment based on your specific circumstances. SSI recipients face unique challenges because the resource limits for SSI eligibility haven't been updated in decades. You can't have more than $2,000 in countable resources as an individual or $3,000 as a couple and still qualify for SSI. These limits haven't changed since 1989, which means they've lost nearly 2/3 of their real value due to inflation. This creates a cruel trap where beneficiaries can't save any meaningful amount of money for emergencies without risking their benefits. Dual beneficiaries. Some people receive both Social Security benefits and SSI simultaneously. This typically happens when someone's Social Security benefit is very low and SSI supplements it to bring their total monthly income up to the SSI federal benefit rate. If you're a dual beneficiary, both your Social Security benefit and your SSI payment are affected by COLA adjustments, though the calculations work differently for each program. Age requirements and special situations. Now, let's talk about age and timing, because this trips people up constantly. If you're already receiving benefits, your age doesn't affect whether you get the COLA increase. You get it regardless of whether you're 62, 70, or anywhere in between. The COLA applies to your benefit amount, whatever that amount is based on when you claimed. However, if you haven't started receiving Social Security yet, you won't see the increase until you actually begin collecting benefits. This seems obvious, but I get questions about this regularly. Some people think that delaying their benefits means they'll get a retroactive increase for all the COLAs that happened while they were waiting. That's not how it works. The COLA increases only apply to benefits you're actually receiving. There's also a special situation for people who turn 62 during the year. Your initial benefit calculation is based on your earnings history and the age at which you claim, but once you're receiving benefits, you then receive all future COLAs like any other beneficiary. Working while receiving benefits. If you're working while receiving Social Security benefits and you're under your full retirement age, there are earnings limits that could affect your benefits. However, the COLA increase still applies to your benefit amount, even if some or all of your benefits are temporarily withheld due to excess earnings. This is important because when you reach full retirement age, Social Security recalculates your benefit to give you credit for any months when benefits were withheld. So the COLA increases are factored into this recalculation, meaning you don't lose those increases permanently. Let me give you a real-life example to illustrate this. Meet Richard, who started receiving reduced Social Security benefits at age 62 while still working part-time. His annual earnings exceed the earnings limit, so Social Security withholds some of his monthly benefits. However, the COLA increases still apply to his benefit rate. When Richard reaches his full retirement age of 67, Social Security will recalculate his benefit to account for the months when benefits were withheld, and this recalculation includes all the COLA increases that occurred during those years. Richard won't lose those increases. They're just temporarily deferred until he reaches full retirement age. Family benefits and dependents. If you have dependents receiving benefits based on your work record, such as a spouse caring for your young child, or your disabled adult child, those dependent benefits also receive COLA increases. The family maximum rules still apply, but the percentage increase affects everyone receiving benefits on your record. This is particularly important for families where multiple members are receiving benefits. Let's say you're receiving retirement benefits and your spouse is receiving spousal benefits based on your record. Both benefits receive the COLA increase, though the dollar amounts differ because the benefit amounts are different. Your spouse's benefit is calculated as a percentage of your primary insurance amount. So when your benefit increases, the spousal benefit calculation changes accordingly. Now that we've covered who qualifies, let's dive deep into the actual numbers because this is where understanding can truly empower you to make better financial decisions. I'm going to break this down in a way that makes sense for your real life, not just in theoretical terms. The current COLA percentage, the most recent COLA adjustment stands at 3.2% for the current benefit year. Now, I know some of you are thinking that 3.2% doesn't sound like much, especially when you're feeling the pinch of inflation every time you go to the grocery store or fill up your gas tank. And you're not wrong to feel that way. The COLA calculation has been controversial for years because many beneficiaries and advocates argue that the CPIW doesn't accurately reflect the inflation that seniors actually experience. Think about it this way. The CPIW is based on spending patterns of urban wage earners and clerical workers, people who are typically younger and still working. But seniors spend a much larger portion of their income on healthcare, which has been inflating faster than most other categories. Seniors are also more likely to own their homes outright, meaning they're less affected by rent increases but more affected by property tax and home maintenance cost increases. The current formula doesn't weight these factors as heavily as it probably should to accurately reflect senior spending patterns. Nevertheless, 3.2% is what we're working with, and for many beneficiaries, this translates to meaningful increases when applied to their monthly benefit amounts. Calculating your individual increase. Let's walk through some specific examples using real benefit amounts that represent typical beneficiaries. I'm going to show you exactly how to calculate your own increase so you can verify what you should be receiving. Average retirement beneficiary. Let's start with Martha, who represents an average retirement beneficiary. Before the increase, Martha was receiving $1,907 per month. This was her full retirement benefit amount because she waited until her full retirement age of 67 to claim benefits. Here's the calculation. $1,907 times 0.032, which is 3.2%, equals $61.02, so Martha's monthly benefit increased by $61. Her new monthly benefit is $1,907 plus $61 equals $1,968 per month now. $61 per month might not sound like the $300 we've been discussing, and you're absolutely right to notice that. But remember, we're building toward that $300 figure by looking at multiple factors. We'll get to how these combine shortly. Higher earner. Now let's look at James, who had higher lifetime earnings and delayed claiming benefits until age 70 to maximize his monthly payment. Before the increase, James was receiving $3,822 per month, the maximum benefit for someone who claimed at age 70 in the previous year. Here's James's calculation. $3,822 times 0.032 equals $122.30. James's new monthly benefit is $3,822 plus $122 equals $3,944 per month. James sees a larger dollar increase than Martha, but the percentage increase is the same. This is an important principle to understand. Social Security COLA increases are proportional, not flat amounts. Lower earner, now consider Patricia, who had lower lifetime earnings and claimed benefits at age 62, accepting a reduced benefit amount. Before the increase, Patricia was receiving $1,200 per month. Patricia's calculation, $1,200 times 0.032 equals $38.40. Patricia's new monthly benefit is $1,200 plus $38 equals $1,238 per month. Patricia's dollar increase is smaller than both Martha's and James's, even though the percentage increase is identical. This highlights one of the challenges facing lower-income beneficiaries. A percentage-based increase means those with smaller benefits see smaller dollar increases, even though they're often the ones who need additional income most desperately. Disability beneficiary, let's look at Michael, who is receiving Social Security disability insurance. His benefit before the increase was $1,537 per month, which is close to the average disability benefit amount. Michael's calculation, $1,537 times 0.032 equals $49.18. Michael's new monthly benefit is $1,537 plus $49 equals $1,586 per month. Disability beneficiaries receive the same COLA adjustments as retirement beneficiaries, calculated the same way. Survivor benefit. Finally, let's consider Susan, a widow receiving survivor benefits based on her deceased husband's work record. Her survivor benefit before the increase was $1,784 per month. Susan's calculation, $1,784 times 0.032 equals $57.09. Susan's new monthly benefit is $1,784 plus $57 equals $1,841 per month. The compounding effect of annual increases. Now here's where things get really interesting. And this is something most people don't fully appreciate. These COLA increases compound over time. Each year's increase is applied to your already increased benefit amount from previous years. Let me show you what I mean with a long-term example. Let's say you started receiving a $2,000 monthly benefit 10 years ago. Here's how that benefit would have grown with just the COLA increases over the past decade. Starting benefit, year 1 $2,000 after year 2 COLA, 1.7% $2,034 after year 3 COLA, 1.5% $2,064 after year 4 COLA, 0% $2,064 after year 5 COLA, 1.7% $2,099 after year 6 COLA, 0.3% $2,105 after year 7 COLA, 2% $2,147 after year 8 COLA, 2.8% $2,207 after year 9 COLA, 8.7% $2,399 after year 10 COLA, 5.9% $2,541 after year 11 COLA, 3.2% $2,622. Your benefit has grown from $2,000 to $2,622 over 11 years, an increase of $622 per month, or 31%. This demonstrates the power of compounding increases over time, even when individual annual increases seem modest. Where the $300 figure comes from. Now let's address the $300 figure directly, because I promised you clarity on this. For many beneficiaries, especially those who were receiving benefits in the range of $1,800 to $2,000 per month several years ago, the cumulative effect of multiple years of COLA increases, combined with other factors, has resulted in their monthly benefits being approximately $300 to $350 higher now than they were 3 or 4 years ago. Let me illustrate this with a specific real-world scenario. Consider Eleanor, who started receiving Social Security retirement benefits in early 2020 at her full retirement age. Her initial benefit was $1,850 per month. Let's track what happened to Eleanor's benefit over the following years. 2020 benefit, $1,850 2021 with 1.3% COLA. $1,874 2022 with 5.9% COLA. $1,985 2023 with 8.7% COLA. $2,158 2024 with 3.2% COLA. $2,227 Eleanor's benefit has increased by $377 per month over 4 years. This is where the $300 plus increase figure comes from. It's the cumulative effect of multiple years of adjustments, with particularly large increases in 2022 and 2023 when inflation was running especially hot. Medicare premium considerations. But wait, there's more to this story, and this is crucial for understanding your actual take-home amount. If you're enrolled in Medicare and having your Part B premium deducted directly from your Social Security check, the net increase you receive is affected by changes in Medicare premiums. The Medicare Part B standard premium for the current year is $174.70 per month. Last year, it was $164.90, and the year before that it was $170.10. These premium changes affect your net Social Security payment. Eleanor's actual take-home increase over 4 years is $347 per month, even after accounting for Medicare premium increases. This is still a substantial increase and close to our $300 figure. However, there's an important protection built into the system called the Hold Harmless provision. This provision protects most Social Security beneficiaries from having their net Social Security payment reduced from 1 year to the next due to Medicare Part B premium increases. If your Medicare premium increase would be larger than your COLA increase, the Hold Harmless provision limits your premium to an amount that doesn't reduce your net payment. This doesn't apply to everyone, though. High-income beneficiaries who pay income-related monthly adjustment amounts, or IRMA, for their Medicare premiums aren't protected by Hold Harmless. Neither are new Medicare enrollees, beneficiaries who aren't having their premiums deducted from Social Security, or those who have Medicaid paying their premiums. State supplements and additional benefits. Some states provide supplemental payments to SSI recipients or other beneficiaries. These state supplements vary widely from state to state, and they may or may not increase when federal benefits increase. If you receive state supplements, you need to check with your state's social services agency to understand how their supplements are affected by federal COLA increases. Additionally, some beneficiaries receive payments from other sources that might be coordinated with their Social Security benefits. For example, if you receive a pension from work not covered by Social Security, your Social Security spousal or widow benefits might be affected by the government pension offset. Or if you worked in non-covered employment and are receiving both a pension from that work and Social Security benefits based on other covered work, your Social Security benefit might be reduced by the windfall elimination provision. These provisions don't eliminate your COLA increases, but they do affect your overall benefit calculation in complex ways. If you're subject to GPO or WEP, I strongly recommend consulting with a Social Security advisor to understand exactly how COLA increases interact with these provisions in your specific situation. Timing is everything, especially when you're counting on money to arrive for bills and expenses. Let's talk about exactly when you can expect to see this increase in your bank account or mailbox, because the timing isn't always what people expect. The standard payment schedule Social Security benefits are paid on a specific schedule based on your birth date, not randomly whenever the Social Security Administration feels like processing payments. Understanding this schedule helps you plan your finances and know exactly when to expect your money. Here's how the standard payment schedule works for retirement, survivors, and disability benefits. If your birthday falls between the 1st and 10th of the month, you receive your benefits on the 2nd Wednesday of each month. If your birthday falls between the 11th and 20th of the month, you receive your benefits on the 3rd Wednesday of each month. If your birthday falls between the 21st and 31st of the month, you receive your benefits on the 4th Wednesday of each month. There are exceptions to this schedule. If you started receiving benefits before May 1997, you're paid on the 3rd day of each month regardless of your birth date. Also, SSI payments are paid on the first day of each month, following a different schedule than Social Security retirement, survivors, and disability benefits.